Hi, and welcome to our live series where we connect you with some of the best IVF experts from across the country to help you fulfill your dream of becoming a parent. Today, we are talking with Dr. Mala Raj, who is an endoscopic surgeon and fertility specialist. She's also the founder secretary of Indian Association of Gynecological Endoscopists, the Tamil Nadu chapter, and the managing director of Firm Hospitals in Chennai. And today, we're talking to her about who needs to opt for IVF and how we can go about it. Thank you, ma'am, for joining us today.
Yeah, thank you. Yeah.
So, ma'am, right off the bat, what I would like to understand, and I'm sure even our audience members are curious, is that are there particular contributing factors that put certain men and women more, or make them rather more uh, suited to an IVF procedure as compared to others?
Meghna, see, the reason why we resort to IVF is mainly based on the, the both the partners, both the male and the female partners. So the problem could be either in the gamete, either it could be in the egg or it could be in the sperm,
Hmm.
or it could be either because they are not able to meet in the passage where the egg and the sperms, they are not able to meet up. And the next important factor, it will be either because the the soil, the place where these gametes fertilize and form an embryo, that soil is not good. So these are the three major factors, in fact, where in we have to resort a couple for IVF. So, so if you really look into these things, like considering the female factors, okay. So again, in the female factor, as I said, there are three major important things in the female. The wherein the problem could be either in the ovary, that is where the eggs are being developed. Okay,
Hmm.
so many a times we see that the quality of the egg is compromised. So this happens either because of some kind of a pathological disease within the ovary, like as you see, like in endometriosis,
Hmm.
where the eggs get compromised, and also in case of polycystic ovarian disease or syndrome, where the quality of the egg is again affected, and it could be because of the age, where both the quality and the quantity is compromised. So in these issues, again we have to resort to IVF. So next would be the fallopian tube. That is, once the eggs are being produced, it is being picked up by the fibria into the fallopian tube, where it meets the sperm. So again, now if this egg which is being released is not able to meet the sperm, so the fallopian tube is a spot where they meet. If they are not able to meet together, then obviously fertilization is not happening, and also you're not going to have an embryo. So this could be either because of some kind of a problem in the fallopian tube itself, like maybe the fallopian tube are damaged because of some kind of a previous infection or some kind of other factors. So again, in such a scenario, what happens is that the egg and the sperm, they stay apart without meeting, and you are not able to get an embryo. Now the third factor apart from these two would be the womb, that is the soil, the
Yeah.
endometrium. Okay, so now that the egg and the sperm have met, okay, and you also got an embryo. So now, if this embryo finally has to get implanted, I mean deposited in the the womb, the inner layer of the uterus, the endometrium. So if that environment is not very conducive for this embryo to grow, okay, so meaning, so however good the seed is, if the soil is not good enough, okay, it's not fertile enough, then obviously the seed is not going to grow. So the same thing happens here. Even if the embryo is going to come and get deposited inside the endometrium, the endometrium is not accepting the embryo. So as a result, what happens, it will keep on rejecting the embryo, and the embryo will just get washed off. So again, that is another major factor for us to resort to IVF. So these things are very, very important. So while you are taking a women for a fertility treatment, we have to thoroughly evaluate where exactly the problem lies, and based on that we have to offer them the treatment. Now, having said about the female factor, the factor with the men also plays a very major role. Okay, so we need only two hands together can make a noise. Okay, so the same way, even the male factor should be good enough for them to conceive. So if there is any compromise on the quality of the sperm, or in the the count, the motility, the the morphology, the shape of the sperm, all those things are also very very critical for them to fertilize the egg. See, the egg should the sperm should have the, even if it meets the egg, it should have the capacity to go and inject itself into the egg. Okay, so it has to penetrate inside the egg and fertilize. If that is getting affected, then again we need to help them out with kind of IVF, wherein we inject the sperm inside the egg. So these are the very major factors why we have to resort a couple to IVF.
So, ma'am, you spoke about endometriosis and you also spoke about PCOS just a while back. I
Yeah.
wanted to understand.
Yeah, Meghna. I think. Okay, fine. So about endometriosis and PCOS, you wanted to hear. I think there was a lag. I think
So, a bit of a lag. Yeah,
yeah.
yeah.
Okay.
So, ma'am, you were talking about metriosis and PCOS, but there's another, thing that we sort of hear a lot about when it comes to gynecological problems in women, which is uterine fibroids. Do you think
Yeah.
women with uterine fibroids should, or rather, are also suited for IVF if their doctors deem it right?
See, it depends. Like, not necessary that all women with fibroid is going to have an IVF. Not at all. So it all depends upon the site of the fibroid, the size of the fibroid, how much is going to affect the inside lining of the fibroid. I mean, of the uterus, and what is the age of the couple. All those things we take into consideration. See, suppose if the couple is very young and they have a fibroid, then we can, like, if it is going to affect the cavity of the uterus, okay, because we don't want any kind of an interference where it is going to come and get implanted, the embryos. So where it is an interference to the embryos implantation, the fibroid is going to be there, then we obviously remove those fibroids depending upon how exactly they are located, either laparoscopically or hysteroscopically. And then again, if the women is, or if the couple is young, we try naturally, because initially nature is the best selection, right? So only then IVF comes, how much ever it is. So we allow nature to take its course after removing this, the fibroid. Give them some time for them to conceive naturally if they are young. But if the couple, if the woman is little, elderly, if we are worried about, like, about her ovarian reserve, she is going to have few eggs and she doesn't have enough time with her for us to try all these natural methods, then obviously we need to resort to IVF. So, having said that, we also need to understand which are the fibroids which we need to remove. So, only the fibroids which are interfering with the cavity. So, okay, let me show you. So, see this, you have your uterus, and this is the inside lining of the uterus, and this is the muscle of the uterus, and this is the outside layer. So, if with the fibroid is going to be inside the layer of the uterus, then obviously this is where the embryos are going to get implanted. So it is going to affect the implantation of the embryo, so we have to remove it. But if the fibroid is going to be within the muscles of the uterus and well away from that of the cavity, then we don't have to remove it. But if it is a huge fibroid, say anything more than 4 centimeters or something, then by the intrinsic nature of the fibroid, it will interfere with the implantation. So that again we need to remove it laparoscopically. And if the fibroid is outside the uterus, it depends on various other conditions. Depending upon the size of the fibroid, whether if we have to remove or not, we will decide. If it is a big fibroid, then obviously we like to remove it, because we don't want any kind of an irritation on the uterus, and where it is kind of pushing the embryos and not allowing it to implant at all. So based on the size of the fibroids and the site of the fibroids, we decide how we have to manage them.
So, ma'am, now that we're talking about surgical interventions, Is it, can endoscopic surgeries, can they help women with fertility problems so that they can conceive naturally and not go for IVF?
Yeah. So that is very, very important, Meghana. One needs to really understand there is very gray zone between the normal conception and the ART procedures like IVF and all that. There is no necessity to immediately jump into IVF. There is a very nice area called the laparoscopic surgical procedures which can be done for these women, or hysteroscopic procedures wherein we can allow these women to get pregnant naturally even before resorting to IVF. Okay, so for instance, many a times you see that women with I have mentioned in depth about fibroids. So wherein we have to go for an IVF procedure. But now similarly, when we have women with PCOS, many a times many of these PCOS women are being being offered an IVF procedure. But then it is really not necessary that all the PCOS women should go for an IVF procedure, because there is a procedure which we can do laparoscopically and make the women ovulate. Okay, so but the most important factor one needs to really understand is that we need to have a very clear cut diagnosis as to whether it is really a PCOS or not. So many a time the diagnosis is not right. The normal ovary is being thought to be a PCOS. So that is when the problem arises. So if you have a very clear cut criteria, if you follow all those things and diagnose a PCOS, then if you do a laparoscopic ovarian drilling for these women, so these are the women who have a very high AMH, meaning their ovarian reserves are very high. So they have the excess male hormones in them. So when we do this laparoscopic ovarian drilling, the male hormones drop. That is, the androgens, they drop drastically. So that is the one which is being a very big hindrance for these women to ovulate. That is, they don't allow the women to get pregnant by, producing the eggs, by not producing the eggs. So when we do the laparoscopic ovarian drilling, we see that the androgens drop and the woman is able to ovulate. So once a woman is able to ovulate, then obviously the chances of her getting pregnant is really high. So again, laparoscopy helps these women with PCOS. And again, as I mentioned, in case of fibroids, many a time because the fibroid is being an interference, if you remove them, they get pregnant. And also in many other cysts, okay, you can remove the cyst and allow the women to get pregnant. And sometimes tubal blocks, many a times there will be very very flimsy, like a very some mucus plug or something which is just obstructing the passage. So we do a hysteroscopy and laparoscopy procedure. We cannulate the tube, we flush out the tube so that the mucus plug get dislodged, so that the egg and the sperm are able to meet and they are able to have a normal conception. So these are the ways by which the endoscopy procedure enhance their fertility, and one can even avoid an IVF. But if none of these are going to work, then and also if age is not in the women's favor, then obviously we don't have to waste much time on all these things. We can immediately shift to the IVF.
Now that we're talking about age, can you tell us a little bit about what are the success rates of IVF across age brackets?
Yeah, it's very important, Meghna. See, the age plays a very major role in decision making. So when a couple comes to us, like for fertility treatment, the first and the most important thing that I really look into it, more than the period of marriage, I look at the age. Okay, so because age is one which really determines how much of eggs and how many sperms the couple. Of course, the male it is not much, but the women it plays a very very major role. So it is the quality, not only the quality, it is also the quantity of the eggs which really matters. So the more number of the eggs, the better the quality, the better the conception. So it has been found that there is a drop in the the egg quantity once a woman hits 30. So because all these eggs are predetermined, Okay, the moment the child is born, there will be about some 2 to 3 millions of eggs in the ovary. But then there is a drastic drop after she is born and she attains the puberty. It is, reduced to so many lakhs. From millions it comes down to lakhs. Then every month she is menstruating, right? So totally, if you see in a lifespan, she will have only 450 ovulations. Totally, she will have 450 ovulations. So in that 450 ovulatory cycles, how many eggs are going to meet the sperm is what matters. Okay, so if she has age in her favor, then there is a better chance. So it has been found that a woman at the age of 30, the conception rate will be almost like close to 60%. Because not only this, the chromosomal abnormality is what we need to look into. The older the women is, they'll have more chromosomal abnormality, and because of that, the embryo will not be good. They'll have aneuploidy, and as a result, there will be more chances of abortions, missed abortions, and all that. So a women of 30 will have almost 60% of chances of her to get pregnant with good quality ooze eggs. But the same thing when she becomes 40 years or so, that it drops. So it drops even up to 20%. So there is a drastic drop in the egg quality and also the quantity after 40 years. So that is when we have to really rush them, like tell them that the age is not in favor, and we have to try to get them as early as possible, so that they don't burn out all the eggs which are there in the ovary, and also the quality of the eggs are also not compromised.
So the age of the female factor then is one big factor when it comes to, deciding whether or not IVF is right for a couple.
Yeah, very, very, very important factor. Yes.
And then there are those other problems that you just spoke about when we started the program, and all those
Yes.
things come together to then decide whether or not you should in fact go in for IVF.
Yeah, exactly. So, yeah, yeah,
So,
tell me.
ma'am, can couples at home can they gauge themselves that, okay, I am the right candidate for IVF? If not, then when is the right time to go see a specialist?
Yeah, no, 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 no. The couples by themselves, they cannot judge whether they are the right candidate or for IVF or anything. See, basically, a couple, if they are married for more than 1 year, and if they are living together, and if they are not, getting pregnant, then obviously we need to, understand that there is some hindrance somewhere. It could be either in the male factor or it could be the female factor. They just cannot Google and attribute everything to themselves. Many a times this is becoming a big problem, because they keep Googling and they think that they are the most fittest couple in the earth, and everything looks normal. Their cycles are regular, they have regular contact, and so they have no reason that they should not get pregnant. They are totally getting misguided, but they don't understand that like there are many other factors which is beyond them. All these things which they are thinking, which are attributing to the factor that they are not getting pregnant. So more than 1 year, if they are not getting pregnant, it is always a good idea to visit a. You don't have to meet even an IVF specialist immediately. You can meet a gynecologist to find out whether everything is all right. Just ensure that you're having good number of eggs. Okay, so AMH is a very beautiful and a very simple test where we can really find out how many eggs that the women will have in her lifetime. Okay, so sometimes because it is really very, very pathetic to see even young girls as young as 25 also coming out with totally burnt out ovaries. They don't have any eggs at all. So we will be, in fact, not only the patients, even as gynecologists and fertility specialists, we get surprised to see when we are stimulating them for them to produce eggs, they are not throwing any eggs. So when we, in fact, do the AMH, we see that it is totally down. Okay, it is less than even zero point 0.4 units. So those kind of women, obviously, even at such an young age, they may have to go for donor eggs. So I have couple of patients whom this has happened, and I have offered them donor egg, and they have got babies and gone. So this is not something, very rare. Of late we are seeing girls coming with very, very poor eggs. So that is the reason, if they are really planning, and they want really time for themselves to start their family, at least get yourself ascertained whether everything is all right. Just get your, the AMH done, and let your husband get your semen analysis done, and make sure all those things are normal. You can also get an ultrasound to done to ensure that the uterus is also normal, because many a times we see certain abnormalities in the uterus. Okay, it is not just mere fibroids, it's not mere PCOS, it is not mere ovaries. Many a times we also see certain abnormalities within the cavity of the uterus, where the eggs are, the embryos are going to get implanted. We are seeing, the in uterus, instead of being a single uterus, you have a wall in between the two layers, which is like a septum. So those are the things which will not be data, because the lady would be menstruating. She'll be
Yeah.
having normal cycle. She'll be having normal flow. She will have absolutely no clue as to even think that she will be an infertile candidate. So
So
these
you
are
just
the
don't
factors.
delegate home because your periods are completely normal.
Obviously, yeah, they will get totally misguided because they think everything is all right. So only when they come to us, and when we start evaluating, when we do an ultrasound, we will pick up all those things, and we can advise them. So that gives them a warning sign. Okay, no, it is not as easy as we are thinking. I keep telling them, it is not that you're going to think that you want to get pregnant this month and you're going to fall pregnant next month. It is never going to happen that way. You definitely need to give them some time frame. So once you think about pregnancy, if everything is normal, also it will definitely take 6 months for you to get pregnant. So they should not waste their time thinking they are the best person to treat themselves. They have, if they really want to take some time, let them meet the gynecologist, get themselves evaluated, and if everything is normal, then possibly they can wait, and wait for nature to take its course.
So, ma'am, we've had a question from an audience member, and it's quite a pertinent question on that. The
Yeah.
question is that how do we find the right specialist for IVF?
Yeah, so that is very, very an important question, because basically it is like you have to choose the right doctor and the right center. Okay, the primary most important thing is IVF specialist, the doctor should be able to handle everything. So ideally speaking, what is my thinking is like a better IVF specialist is also an endoscopic surgeon, because it is a comprehensive treatment. Okay, so this endoscopy and IVF, they go hand in hand. As I said, that not necessary that all the patients should be rushed to IVF. Okay, so there is a area which there is prior to IVF, wherein an endoscopic surgeon can play a very, very vital role, in getting a woman pregnant naturally itself. So only when that is not happening, then you can move to the IVF. So it will be good if a gynecologist is both an endoscopic surgeon and an IVF specialist, and has got all credentials. And next would be the center which they are choosing also should be it should be certified, and also they should have the basic, and the all the ethical things they have to follow, and they have to ensure that they have all facilities, as in case of emergencies or something like that coming up, they should be able to handle all of those. So ideally speaking, the doctor and the center plays a very vital role.
So, ma'am, another question that we have is that, since we spoke about endoscopic and laparoscopic procedures, are there any side effects of laparoscopy in fertility cases? This is another audience question.
Okay. See, laparoscopy side effect as such, we cannot say that side effects. It is just that we need to decide. So, for which condition we need to do the laparoscopy. Okay. See, in case of, as I mentioned earlier, in case of a polycystic ovarian disease, not all polycystic ovarian disease we have to drill. Okay,
Hmm.
so many a times if you drill a normal ovary, then the ovary gets burnt out. It will reduce the reserve. So in such a scenario, you have to be very clear with your diagnosis. You should know it for sure it is only a PCOS you are dealing with, and only then we need to drill. Then many a times, laparoscopic surgeries are a very highly skilled surgeries. So the gynecologist should be really an expert, because for a regular gynecological issue. So if you are just going to remove a fibroid for a gynecological issue, say meaning if it is going to be for a bleeding, then it is a different issue altogether. But when the fibroid is for a fertility issue, so
Yeah.
we consider many things into we bring many things into consideration. Like, we need to understand the fibroid. We need to understand the fibroid first, whether that is a reason for infertility, and how to approach these fibroids, whether to approach this fibroid hysteroscopically, that is from below, or whether to approach these fibroids laparoscopically from below, or to approach it in a combined manner. And also, it is just does not stop with removal of the fibroids. It also ensures that the surgeon, I mean the gynecologist, should be very, very skilled endoscopic surgeon, who can also suture the uterus back to its normal configuration after at the end of the procedure, because these are the uteruses which has to hold on to the pregnancy. So that is the reason I said you have to choose a gynecologist who's very, very skilled in this endoscopic procedure, so that they are able to do these procedures safely for you. And in fact, I do is I remove the fibroid, and also I ensure that I put them inside the bag, and morcellate, meaning I cut the fibroid inside the bag and remove them, so for the additional safety. So these are the small things which we need to really take into consideration. And there should not be any damage to the inside lining of the uterus when you're removing these fibroids. So many a times, while doing this fibroid surgery hysteroscopically or something, like, you should not, there will be a damage to the inside lining of the uterus. So you should ensure that there is no damage, so that it is technically challenging one, and a person who is really expertised in such a thing only will be able to do this procedure for a fertility patients. So those are the things that we should really take into consideration when it comes to fertility and these endoscopic laparoscopy or hysteroscopic procedures.
So clearly, finding the right specialist for yourself here is important, especially if
Yeah.
they're going to be endoscopic interventions to ensure that you can get pregnant and your subfertility issues are gone.
Yes, that's very, very vital.
Okay. So
Yeah.
another audience question that we have is that the procedures and the flushing that we're talking about here, can they lead to normal pregnancy as well?
Yes, yes, very much. So many a time, that's why I said, many a times I kind of remove this fibroid, and the women are able to get pregnant naturally. So, for instance, recently, just before COVID, a woman married for almost 7 to 8 years. She came with a huge fibroid uterus, and I had to do a laparoscopic myomectomy. In fact, she was offered an IVF. So outside, so I did and laparoscopic removal of the fibroid, and I told her, like, if we are going to do an IVF, we don't want any hindrance on the uterus, for the implantation and other things. So we will first make sure that we remove the fibroids and then proceed with the IVF treatment. So I kind of removed that fibroid. It was a real huge one, almost 8 centimeters by 8 centimeter fibroid. Remove the fibroid, and it so happened that was during the lockdown period. So immediately the next month was a lockdown. The actual plan was that we'll remove the fibroid and start with the IVF procedure 6 months later. That was a plan between the couple and me. But then what happened was, because of the lockdown, the patients also were not able to come back to the to the hospital. So what happened, they were at home only, thinking and let everything get over. So it so happened that after 6 months she became pregnant. So this was a candidate, very ideal candidate for IVF. So which clearly shows that fibroid was the only reason for her
Yeah.
delay in conception. So the moment I removed this fibroid, in 6 months' time, she became pregnant. And in fact, she went through the pregnancy. She was from outside Chennai, so like she continued with her gynecologist there. And then now recently, in fact, last month she came back to me with a baby. So I was very surprised. So she said, so your fibroid surgery really helped me to get pregnant. Normally, I didn't have to also go for an IVF, and she came to show the baby after everything settled down. So that is why so many patients have got pregnant naturally. after the fibroid surgery, after the endometriosis surgery, after PCOS delay, and many things are there. So that is the reason, like this is a very beautiful
Yeah.
procedure which can be done. Yeah.
So, ma'am, now you mentioned that specialist, tried other fertility treatments as well, but IVF is the ultimate course of action for them. What should people then who are going in for IVF, what should they prepare themselves with? What should they be aware of, and what actions should they take to ensure that they're ready for the treatment ahead?
Yeah, so basically speaking, if it is very clear that IVF is the only treatment option now that available for them, so they should ensure that the general health is well taken care. Okay, so how you prepare yourself for IVF, as you said, is asked, is very very important. Okay, meaning your general condition. Okay, right from your body mass index, your weight. So you have to ensure, if you are obese, make sure that you reduce weight. Okay, so an ideal body mass index should be maintained, ideally speaking, to have a better IVF outcome. So because why? Because when you are obese, the quality of the oocytes are also going to get compromised. So because of the the poor quality of the eggs, then you have a poor embryo. So because of the poor embryo, you will not have an implantation, and you will obviously not have a pregnancy. So ensure that your body weight is well taken care. And also your, like if you have any other comorbidities, like if you have any diabetes, get your sugar under control. If you have hypertension, get it under control. Because in once you get pregnant, so first during, I mean, to get pregnant, all this will be a hindrance. And even if you fall pregnant again during pregnancy, you have lots of other issues coming up because of all these diabetes and
Yeah.
hypercomorbidities. So ensure that all these are taken care, and check your thyroid. If your thyroid is also again abnormal, make sure that you take your thyroid tablet. Because once you take your thyroid tablet, then obviously it is not only good for the the gametes, but it is also good for your pregnancy. Because many a times, if the thyroid is not brought under control and the woman gets pregnant, there is a chance that it also affect the baby. So the baby
Yeah.
also can have lots of IQ issues and all those things. So you have to ensure that all these are taken care. And also you should have a good supplement of folic acid, so which is very very vital. And if you are anemic, make sure that your hemoglobin is well corrected. So these are a few things that you need to really ensure, like all these are done before venturing into an IVF. And also make yourself physically active. Because once you start an IVF treatment, then many a times, like once embryo is being transferred, you have to be on rest and all those things. Like if you are an active person and if you maintain an ideal body weight, then it becomes quite easy for you to go through that IVF treatment. And also again, when you fall
Yeah.
pregnant, it becomes very simple.
So, one question that we have from our audience members is that
Yeah.
are there any particular foods to avoid during IVF?
See, ideally speaking, like foods to be avoided, meaning like we do not advise any, too much of red meat, and reduce the salt, reduce the oil, all those things. And then highly nutritious food is what we recommend. We tell them to take more of fruits, more of vegetables, and also I mean, when they are, I mean, of course, it is a myth about the papaya and pineapple and all. But then when we are venturing into so much of all these things, we just ask them to avoid all those things, fruits alone. But ideally speaking, to take more of fruits, more of vegetables, more of water, and like less of red meat. But then we advise them to take the white of the egg, because that got more of protein. And even dry fruits, we ask them to take quite a lot of badams and all that, because we here in this treatment we need more protein, we don't want the fat. So and also carbs also should be in moderation. So all these things is what we need to really look into. Yeah.
So, basically, a healthy diet is what we're looking at. Like
Obviously, yes,
good,
yes.
eat healthy,
Yeah.
you follow
Yeah.
those protocols before and during your IVF journey.
Yeah, and it is going to be helpful for you during pregnancy also. You can just continue the same thing. Yeah.
So, ma'am, as we come to a close, on our session, are there any tips or advice that you would like to give to, couples watching this who've been trying to get pregnant for a while?
Yeah, see, what I would like to really suggest is that, if you are married for more than 1 year, and you have really been trying to get pregnant, then it is better not to, delay visiting your doctor. Okay,
Hmm.
so because our biological clock is also clicking, and as I mentioned, we seriously don't know the fertility status of ourselves unless and until someone really evaluates us and bring all those things into focus. So if we are really planning for a pregnancy, make sure, if you are not falling pregnant in a year's time, meet your gynecologist, get both of yourself evaluated, and ensure that everything is all right. And then also ensure that you take a healthy lifestyle with good amount of exercise and a healthy diet. And then like, you can take a call as to what exactly is based on your reports from your gynecologist. First, choose the right gynecologist and trust the gynecologist who's treating you. See, basically, you should not keep hopping from one place to another. One thing that you should understand, because in a month, only once a day the eggs are going to get released. Okay, ovulation is going to happen just once in a month. Any doctor, gynecologist to whom you go, it is just that they will pick that ovulation date and give it to you. I mean, initially that's just for normal consumption. So
Hmm.
that ovulation date, if your egg and if your sperms do not meet, the gynecologist is not at fault. She has picked the ovulation date and given it to you. It is that just that the nature has to take its course. The egg and the sperm have to meet on its own. Many a times, what patients do is they are not falling pregnant in a month's time. Then they feel that the treatment is not all right, and they keep switching doctors. This hopping of doctors and shopping of doctors is not going to do any good to them. So once they decide on the treatment, just trust the doctor and follow their advice, so that you need to give at least 6 months time, so for
Hmm.
yourself and the gynecologist to ensure that you're getting a good outcome. So that is very, very important and vital for not only for you, but also for everybody, in fact.
All right, ma'am. Thank you for this
Yeah.
very insightful session. It has been a pleasure speaking with you today.
Yeah, thank you so much, Meghna, for making it very, very interactive.
Have a nice day, ma'am.
Thank you, same to you.